You graduated. Congratulations. Now comes the next big choice. Where do you launch your career? An internship is the ultimate training year, but the path you choose, academic or private practice, will shape your future. These paths are completely different. Knowing the pros and cons is key to matching your training to your ultimate career goals. Let's break down the two main options. First, the academic internship. This is your university teaching hospital. Its mission, education, and research. Academic programs offer protected time for didactic learning, such as journal clubs, lectures, and daily teaching rounds. This was traditionally the gold standard path if you want to specialize and pursue a residency. Some downsides: lower salary. Academic programs traditionally pay significantly less than private hospitals. And while the cases are cool and complex, you'll have less exposure to more common and routine cases. Also, because the cases are complex, primary management is often deferred to residents and senior clinicians, meaning less ability to perform procedures and have primary case management for you early on. Now, the private practice internship. These are high-volume specialty and emergency hospitals. Their mission: clinical service and efficiency. The major pro is high-volume, hands-on experience. You'll see a ton of cases, especially emergencies, and you often get primary case responsibility faster. And let's be honest, the salary is significantly better, helping to ease that school debt. You get great exposure to the business side of practice, which is essential for future ownership or management. And if you love the hospital, it's a direct pathway to future associate employment. The trade-offs: less protected study time. The focus on clinical service means you're unlikely to have dedicated time for lectures or research. Look for internships that have dedicated intern rounds and journal club. So, which is right for you? It boils down to your long-term goals. Choose an academic internship if you are committed to a residency and specialization and possibly a career in academia. The lower salary is worth the structured training and networking. Choose a private practice internship if you want better pay, higher case volume, and a fast track to general or emergency practice with great procedural skills. A private practice residency is the way to go if you want to train and then practice in a private practice setting. A lot of hospitals like to keep their own, so if residency is your goal, choose an internship in a private practice that hosts a residency in your specialty of interest. Both paths will make you a great clinician. Do externships at hospitals you are interested in, talk to current interns, and choose the environment that fits your vision of veterinary medical practice. Good luck! Hello, I'm Dr. Lisa Powell, a board-certified criticalist and manager of the BluePearl Emerge program. Teaching and mentorship has always been at the core of my career. During my 15 years as clinical faculty at the University of Minnesota, I developed the ECC residency and trained numerous interns. When choosing an internship, whether academic or private practice, you need to consider your goals, like pursuing a residency or gaining clinical experience working with a high-volume caseload. Please reach out. I'm happy to answer any questions about the content of this video or provide more information on BluePearl's rotating internships.